Hello, everyone, and welcome to this audio podcast. This audio podcast is part of a Globular global series or edition. This audio podcast as part of a Lunar Insurgence. This audio podcast as part of a Skeletal Robotics, and this audio podcast as part of a Storm Robotics production. This audio podcast, in this audio podcast, a little bit around in around red cell blood transfusion care. So transfusion practices are incorporating many novel pharmacological agents in view of potential longer-term risks and side effects of transfusion, and there is ever more need to consider sort of the synthesis of for example, the hormone erythropoietin, and in sickle cell anemia, or SCA, or thalassemia, um, uh, in sickle cell and thalassemia carriers, a synthesis defect can be the difference between morbidity and mortality. Although risks are reported in use of erythropoietin, as pharmacological interventions are linked to varying pathophysiological conditions, there has been a sort of a re-evaluation of criteria for the use of blood. However, transfusion practices have not modified due to the challenges in around mortality and morbidity relating to anemia, especially in untransfusible patients or recipients, or those at risk of developing complications. The ability of transfusion to facilitate the transport of oxygen from the environment to mitochondria has repeatedly been demonstrated in physiology research. The physical characteristics of red cells or red blood cells or RBCs, and the bases and in around the bases that allow the solubility of plasma of plasma for oxygen, of plasma for oxygen, has been estimated to be around 30 fold. This affinity, or the affinity of RBCs, red blood cells, for oxygen is modulated by regional acid-base conditions to favor oxygen loading at the pulmonary alveolar capillary interfaces, as well as unloading at the tissue level. Currently or presently, there are no clinically available fluids that have the sort of the loading and unloading and carrying bases of blood. That draws this audio podcast to a close. Uh, uh, that draws this audio podcast to a close. There is an audio podcast series that looks at the importance of considering renal pathophysiology, and in an audio sort of as part of an audio podcast series that looks at the importance of considering renal pathophysiology in patients or recipients who may require red blood cells transfusions, in where patients or recipients may have long-standing illnesses or conditions, or for example, chronic illnesses. And the audio podcast series had been a part of of drafted works, sort of retrospectively. However, in the audio podcast series, in the audio podcast series, there's a link to sort of the underpinnings in around transfusion practices, and around transfusion sort of care, transfusion care and practices in line with transfusion based sort of research as well. So once again, that draws this audio podcast to a close. This audio podcast as part of a Globular Global. This audio podcast as part of a Lunar Insurgence. This audio podcast as part of a Skelter Lobostics, and this audio podcast as part of a Storm Lobostics production.